people want a mask, they can mask. Sometimes I'll feel like I want a mask just to be a little more comfortable.
My mother is immunocompromised, and so is my sister, so I do highly believe in COVID mandates.
I think it's good that it's relaxing its policies, because the city is as well, and it's kind of matching how we're doing outside of school.
Pretty much no matter what the mandates are, I'm just excited to be back on campus and have a normal year.
Well, for some analysis on all of this, let's bring in Dr. Zain Chagla, an infectious diseases specialist and an associate professor of medicine at McMaster University in Hamilton. And Dr. Chagla, we're seeing different approaches from different universities. And let's start with McMaster. It's leaving decisions up to students and staff. So I saw some tweets from Mac, and one of them says, masking is strongly encouraged indoors, but not mandated. Vaccinations aren't mandated, but people are encouraged to keep up to date. Why do you support that approach?
Yeah, I think it goes with what the evidence shows. We want things to be safe, but we recognize that, particularly vaccinations are a personal risk modifier. We have lost with Omicron a lot of the ability for vaccines to prevent infection. 2 doses, really, 20 weeks after that second dose, the protection against infection is lost. Even 3 doses, out of UK, Israel, Singapore, that a lot of the protection against infection is lost by three to 4 months. And so, when we have that in mind, there's no way you can vaccinate people to a point where they're going to be preventing transmission. We've seen that around the world. And I think you have to add to the fact that this last year, a lot of people have had COVID. 60% of the population that would be going to university, 18 to 29-year-olds, have had COVID. And so, when you add that on, the fact that some of them are vaccinated, some of them may not be vaccinated, some of them may have 2 doses, when we see the data showing that their protection against severe disease is very high, regardless of which one of those boxes they fit in, I think you start taking away the role of mandates, especially in vaccination, and you have to start thinking about the harms of that approach, which aren't minimal in that sense.
So let's talk about that. What are some of the harms?
Yeah, look, number one, vaccines are incredibly safe, but there is side effects, particularly in 18 to 25-year-olds. In men, that is the highest described risk group of myocarditis. Now, it's not a high risk. It's about 1 in 9,000 to 1 in 16,000 on the booster dose based on some Israeli data. But again, if you have a young man who has 2 doses of vaccine plus a prior infection, who is no different than having 3 doses of vaccine, and now you're asking them to take an extra risk on top of that, we do have to think about that. Add to that, as public health, we're going to need people on our side. We have other diseases that are circulating, like meningococcus in Toronto. We'll need people when things happen, and we'll need people's trust when things happen. The more we push people away, the less likely they're going to come back. And I think the third point is the booster rate is not the same in every population. We see some of the lowest income communities, some of the most racialized communities, even in London, Ontario, that have booster rates that are less than a third in the 18 to 29-year-old population. And so when you think about the people that are going to be excluded from coming to school unless they make that decision, we may start pushing people out of higher level education at the last minute, which then has, other implications for their benefits to jobs, the benefits to their formative experience in postgraduate education and post-secondary education, and many other factors in that sense.
You mentioned London, of course, the university there, the big one, Western, has taken a different approach than McMaster, and it is mandating boosters, it is mandating masking. So you've talked a lot about boosters, but let me ask you about masking, because I'll bet you some people watching now have this question. What's the harm in that? If masking helps, why not just mandate it in a university classroom?
Yeah, look, I don't disagree. Masking, offers protection. In the best studies, 10 to 20% reduction in COVID transmission, which is good. But I think you have to recognize that a university campus is no different than day-to-day life in many settings where masking is not provided. B, students in university don't necessarily just sit in the classroom all day. They eat together, they live together, they go to bars together, they study together. They're environments together all the time that are in their privacy where masking isn't used. And so, is that risk going to be significantly reduced by masking only in the classroom versus, the fact that, when people go back to their day-to-day lives, that's masking comes off or is optional. And I think, again, we have to give students the right to have a normal year. People want to interact. It's a social experience to be in university. If people want a mask, they should wear a mask. They should wear a well-constructed, well-fitted mask. And again, we have to be sure that in all settings, we are not discriminating against people based on their mask choices, that if they want to wear a mask, they should have the freedom and the availability to wear a mask without any type of discrimination.
Dr. Chagla, we have just about a minute left. I want to slightly switch topics, but still about COVID. I know you do a lot of research. You pay attention to a lot of the information that's coming out. From your perspective, do we have a good sense of what this pandemic is going to look like in the fall?
Look, this pandemic is still affecting people that are immunocompromised and elderly. And we really want to make sure those people are protected going into the fall. They need to be fully vaccinated. They need to be accessing treatments when the time comes, if the time comes that they get COVID. They need to be offered all the protections possible in that spot. We probably will see a rise in transmission. What that means from a healthcare standpoint is unclear. But again, I think we have to focus on the groups where the disease is affecting the most and offer them the most protections rather than worrying about, lower level things like university institutions.
I don't have to tell you a lot of emotional reactions to these topics, and you've decided that you do want to kind of weigh in on this, and we appreciate you taking the time to explain your view on these issues. Thank you very much.
No problem. Thanks, Ian.